From Kansas State University, this is Agriculture Today. Along with Sarah Moyer and Eric Atkinson, I'm Jeff Wichman. From last week's Beef Stocker Field Day at Kansas State, K-State Beef Extension veterinarian AJ Tarpoff discusses treatment failures that are not BRD-related for cattle, but similar and still present significant health concerns. And K-State Anatomy and Physiology Department Head Hans Coetzee talks about ongoing research efforts to develop validated pain assessment tools for cattle. K-State Wildlife Specialist Charlie Lee looks at reproduction research that's been conducted on the lesser Prairie Chicken. And in agricultural news, the latest crop progress report and this week's milk lines. It's all just ahead on Agriculture Today over the K-State Radio Network.
What is radon? Home exposure to radon gas is the leading cause of lung cancer death in the United States for non-smokers. In Kansas, 1 in 4 homes will test at or above the EPA action level. The Surgeon General recommends all homes be tested and fixed if necessary. Visit kansasradonprogram.org for more information. Test, fix, save a life. This message brought to you by the Kansas Radon Program, the Kansas Association of Broadcasters, and this station.
You're listening to Agriculture Today. In our continuing coverage of last week's Beef Stocker Field Day at Kansas State, K-State Radio Network's Sarah Moyer talked with K-State Beef Extension veterinarian AJ Tarpoff regarding his presentation on treatment failures that are not BRD-related for cattle, but do present significant health concerns which producers should identify and treat as quickly as possible. AJ tells Sarah that BRD is the biggest disease threat for growing calves, but not every animal coming into the yard is going to get BRD.
But I did want to break it out today and talk about other things that would look similar, that we have some depressed calves early on arrival that are not bovine respiratory disease. And if we treat them as such, we're going to have treatment failure because we have different diseases processes that are actually happening. The biggest thing with lameness, the two specifics that I brought up today, number one being toe abscesses. Okay, toe abscesses are where we have a hoof wall breakdown. Okay, the hoof goes down to the sole. The sole is the bottom of the hoof, and the hoof wall comes over where those two meet's called the white line. Sometimes where animals damage the bottom of their soles, they will actually tear away enough of that sole that we get exposure of bacteria from the outside environment to get inside the hoof wall. And when that happens, of course, the immune system attacks it and forms an abscess. Well, that abscess is extremely, extremely painful. There's so much pressure on the inside of that hoof that the animal won't want to walk on it. They're very uncomfortable. They'll get very irritable, so they may be very flighty, and they may even get aggressive whenever we try to handle them. Think about it, if you hit your thumb with a hammer and your thumb swells up and you feel all that pressure underneath your fingernail, that's exactly what these cattle are going through, except they have to walk on it. Okay, so they will walk very different. The way that they walk, they will position their feet in very strange ways that cattle should not do whenever they're walking, just to get the pressure off of the toe. The toe that usually gets affected most out of some of these feeder calves are on the back feet, on the outside toe. Okay, that's kind of our most often culprit. Sometimes it's both, but more often than not, it's that outside toe on the back foot.
And you had illustrations and some photos up for lameness and these toe abscesses, as well as other issues that producers might come across. And so if they're curious about those, they can contact you. They can do a quick search online. There's lots of options, but some pictures help illustrate what to look for as producers are being aware of this. Some common causes of the toe abscesses or any type of feet problem that are similar to what you were talking about, those can occur in handling facilities, you were telling the attendees here. And what should people be looking for as they're going through a chute or going through an alleyway, some handling facilities to keep an eye out for to avoid a toe abscess in the future?
Footing and maintenance. Okay, maintenance is key. We don't want to be causing these toe abscesses. Sometimes they happen from damage prior to shipping that we can't control once we bought these animals. Okay, but number one, maintenance on our own equipment. loadouts, unloading areas, making sure all the areas are they're free of any pieces of rebar or any welds break on metal plates on the inside of chutes, making sure all that is repaired like it should be so we have no sharp edges that these animals are going to be running across of. The other thing to be cognizant of is fresh concrete. Okay, we love upgrading our facilities when we have brand new concrete. Keep in mind that concrete could be extremely abrasive to the bottom of those soles, especially if these cattle came off out of grass country. They're not as dense soles, okay, they can be pretty weak. It actually acts like sandpaper with that fresh concrete. So be cognizant of that. Sometimes we may need to put down some bedding, some sand, something to help protect the hooves of these young calves that are coming into the operation. So handling, that's the other thing, is low-stress cattle handling, making sure those animals aren't slipping and falling, and making sure we're not applying too much pressure where they would try to run or try to get away from us, but keeping those animals calm, cool, and collected while we're kind of pushing them through our facility, and then making sure the facility itself has the upkeep and the maintenance to ensure that we don't have any sharp edges.
Another issue to look for upon arrival to an operation, some calves may be experiencing a certain type of arthritis, and this was a point you drove home to be timely about this and to be paying attention on it can really make a big difference. Would you talk about why that is so?
Okay, so some of our infectious arthritis cases, these are the big swollen joints that we see on some of these young calves. Need to make sure that they're not injuries from a chute or from handling. But when we start seeing some of these issues in the carpus, in the hocks, and the elbows, and the stifles, that they get extremely lame, usually on one leg lameness, could be multiple legs. But we start seeing these swollen joints. When we start looking back at the history of these animals, they came in. Usually they get treated for respiratory disease, and about a week, 10 days later, we end up getting them pulled again because they're lame. Okay, they're three-legged lame. They have a big swollen joint. It is not foot rot. Okay, we need to make sure that we clearly distinguish what a foot rot is. That usually happens later in the feeding period, that soon after a BRD insult, some of those bacteria may have seeded into the joints of these cattle where we get a lot of inflammation. That's where we get these blown up joints. The two major players of bacteria that we're dealing with are, one, mycoplasma, and two, Histophilus. So how do we handle these animals? Well, number one is we need to make sure that the respiratory disease is taking control. The respiratory disease could kill them tomorrow. The lameness, the arthritis, that's going to take a long time for total healing to get them back to production. So once we do have them in treatment, we've got the infection under control, we can kill all the bacteria out of that joint, but the inflammation's already there. The damage is already done. So what we need to do is make sure that we handle these animals a little bit differently, where they're on a nice bedded ground in a pretty easygoing pen, where they don't have to compete with their pen mates, okay? They can rest. They don't have to go very far for feed and water. I like to call it the vacation pen for a little while.
And so a good way to help clarify what is this bacterial arthritis and what is foot rot, let's talk about foot rot for a minute, just some reminders for producers how to correctly identify foot rot.
Okay, so foot rot, biggest thing with foot rot is early identification. They will show lameness. It doesn't get to the extreme lameness early in the insult like arthritis, where they'll be three-legged lame. But we really need to examine how they walk, and we need to be able to see their feet. Okay, so if they're walking in too much manure or too much mud in the backside of the pen, we need to make sure that we actually walk them on clear ground. We can tell where they're lame, but we need to isolate where that lameness is coming from. Early in the progression of the disease, they will be lame, but they'll still be putting pressure on that foot. And what you'll notice is the toes may begin to separate, but the backside of the foot, just below the dew claws, just above the backside of the hooves, we'll start to see a bump. Okay, that's where the swelling kind of initiates that we can visualize. As it progresses, the toes will start to separate. We'll have swelling in between the two toes, and then we see the entire, all of the foot just above the hooves. We'll begin to see all that being swollen, basically from the fetlock lower. The biggest thing with foot rot is treat them early. Okay, whenever we get them treated early, they get right back into production. They respond very well. If we wait until they have a big bumblefoot, treatment and therapy are not going to be very successful. Okay, so early finding these animals early, getting them treated appropriately early. Again, work with your veterinarian on a protocol. That way we can get them responded and right back to production as quick as we can.
Good reminders for producers, and there are also some digestive diseases that are good to be mindful of if a calf is not acting as it should or as the producers always want it to be. And what are some of those that are more common, treatable? What can producers do to help prevent that?
Okay, so the two and I brought these up specifically for this discussion today, of things that look like BRD. And unfortunately, grain overload, okay, acidosis. If we misfeed animals by chance, okay, if they ate too much starch, if they ate too much corn, and that gets rapidly digested on the inside of the animal. So what happens is they will get acidotic. Their rumen will create so much acid that they'll go through an acidosis period that it looks very similar to BRD. Okay, they'll be dopey, they'll be slow moving to the bunk, they probably won't move around with the rest of the animals, they'll have a little foam coming out of their mouths, and that will progress pretty rapidly. So we need to be able to distinguish those animals from a BRD case because it's not a bacterial issue. Okay, this was a feeding issue, and we can get them past this, and we can get them treated up pretty well, but we don't need to use antimicrobial therapy. Okay, so that's where distinguishing the difference, maintaining quality feed regimen. Okay, timing is essential, components of feed is essential.
And that second disease, AJ, what did you talk about as another digestive disease that may be similar to BRD in some of its symptoms?
So the last one I talked about was coccidiosis. Coccidiosis is a protozoan parasite that affects these animals. They pick it up in the environment. The one thing that we need to keep in mind is basically all our calves that come in are affected. Okay, they have some level of this protozoal parasite on the inside of their digestive tract. Not all animals will break with disease, so we need to be cognizant of that, but stress is a big indicator whether they're going to break with the issue or not. They will look rough, they'll be depressed, but the biggest thing is it's very stressful on their digestive tract, especially around their rectum and the lower intestinal tract. So they will strain to defecate. These animals, you'll see, they'll be dopey, their coats will be rough looking, their tail heads will actually be spiked up, and they'll constantly be straining to defecate. When we see that, if we look at the manure, a lot of times we'll find blood specks in it. Okay, and that's when we know we probably need to get these animals treated for coccidiosis pretty rapidly. Now, we have treatment products that we can, usually put in the feed or the water. We also have preventative measures that we can use with some of our ionophores soon after arrival to help control and kind of mitigate some of the stressors of coccidiosis.
And can ionophores also help with acidosis sometimes?
Well, ionophores will actually work to ensure adequate feed intake, so they make a meal eater so they don't consume quite as much of the product. And that helps with our feed efficiency, but it also helps reduce some of the risk of our acidosis events, just so we don't get cattle that start binge feeding.
That's K-State Beef Extension veterinarian AJ Tarpoff, one of the presenters at last week's Beef Stocker Field Day at Kansas State. He spoke with Sarah Moyer. This is the K-State Radio Network.
Agricultural producers, landowners, and creditors, you have a partner in your legal and financial needs. Kansas Agricultural Mediation Services offers reliable, trusted information and guidance. Whether you need advice for ag credit concerns or are transitioning your operation to the next owner, Kansas Agricultural Mediation Services can assist you in making sound decisions for your business. To learn more, call 800-321-3276 or visit us online.
Welcome back to Agriculture Today. I'm Sarah Moyer with another update from the 2018 KSU Beef Stocker Field Day. We've heard from a couple of the presenters, and now a third in with us today. We have the head of the Department of Anatomy and Physiology with the College of Veterinary Medicine, Hans Coetzee. Good to have you on, Hans.
Thank you, Sarah. Appreciate the opportunity.
And the topic that you discussed with producers here recently was pain management. You've participated in some research and have some perspective on the topic and what's to come in the future. So will you explain on the cattle side what's been talked about and how recently the first drug was approved for pain management in cattle?
That's a great question. So on the human side, pain assessment is obviously fairly straightforward because you can ask the human whether they're in pain or not. On the cattle side, it becomes more challenging because cattle are prey species, and so they by nature conceal signs of pain. And so we've had to come up with some innovative techniques to try to measure pain in cattle. And these have included approaches such as measuring brainwave activity. And in that research, we've found that, as we've understood for several years, that being able to do these procedures as early as possible in the animal's life is beneficial to the animal as they get older, they perceive the pain more severely than they do when they're younger. And so that was one of the tools that we focused on. Some of the other things that we've used is pressure mat analysis, so a little similar to if you were to go to a Walmart and see the Dr. Scholl's insert where you would stand and it tells you how you're balancing your weight on your feet. We use a similar device in cattle to see how they're distributing weight on their feet to understand if the animal's lame or not and how that animal's responding to pain management. And so our assessment tools have to be validated in order for them to be accepted by FDA. And so that's what we've really focused on, is coming up with validated pain assessment tools so that we can really understand whether the animal is in pain or not, and then more importantly, whether the pain relief drugs we're using are working or not and actually improving the life of the animal.
So, of course, you realize that producers won't have machines to look at brainwaves of cattle, but a pressure mat is a little more realistic. But even so, your studies that you've been doing have also included thermograph technology, and so that measured skin temperature. That was another aspect that you had mentioned in your presentation. How was that then validating the pain levels of cattle at different activities?
That's a great question. So we've been looking at the way in which skin temperature changes in response to pain. So everybody is familiar with the fight or flight response. If you get a fright, it's the nature of humans and animals to experience a fight or flight response. And part of that involves the blood vessels in the skin contracting. And so by effect, that actually cools the skin or lowers the temperature of the skin. And so these thermography devices have been around for several years, and what they allow us to do is accurately measure changes in skin temperature. And it's something that with a very sensitive camera we can detect when the animal has that fight or flight response, and it actually changes the skin temperature. And it's a very visual endpoint that we can use to try to study and assess if the animal is in pain. And so the end goal with all of these tools, like you mentioned, the brainwave activity measurements, the thermography, the pressure mats, is to try to come up with a model that we could use to get drugs approved, but also to use those in conjunction with some of the on-farm assessment tools we would use, such as lameness scoring, that many producers would be familiar with, so that when producers are using those scoring systems and saying this animal is lame and this animal is not, that there's some physiological basis to that scoring system and it's not something that's not validated or not fully understood.
Well, let's talk about the product that is approved if producers are not aware of it already.
So for several years, we've struggled with coming up with a model that would be validated for pain assessment. And finally, we've been able to come up with a lameness model that involves specifically foot rot in cattle. And so using that model, a company recently approved a drug called Banamine transdermal, which contains an active ingredient, flunixin, which many producers would be familiar with Banamine as they've used it on their production system. But what makes this a very novel and unique formulation is that it's applied along the back of the animal, similar to what you would, an ivermectin, a dewormer, and then the drug is absorbed through the skin systemically. So it's very easy to administer the drug because it's topical. You don't have to inject it into the animal. You don't have to find a vein. And so from that perspective, it's very useful. The drug currently is approved for pain relief and pain associated with foot rot specifically, and it's also approved to lower fever associated with bovine respiratory disease. We're getting to the time of the year now where folks are going to start seeing more BRD cases, and this is a drug that's approved specifically to reduce fever and inflammation associated with BRD. So it has those two indications on the label.
You also covered a couple points about how it is working in younger animals versus older animals.
Sure. So the drug is novel because you apply it to the skin. And so with that approach, there are some challenges in terms of ensuring that the drug achieves the concentrations it needs in the circulation of the animal. And so what we found is in younger animals, the drug is absorbed faster, and that makes sense because their skin is thinner. But in older animals, although the drug is absorbed a bit slower, it actually lasts longer. Its activity is actually longer in an older animal than a younger animal. And so from a producer perspective, if you are using this drug in older animals, it is quite effective in controlling pain for up to 48 hours. So we get a good duration of activity because of that slower absorption, but then longer duration of effect. We've also observed that the drug changes in terms of its rate of absorption based on temperature. So on very hot days, it's absorbed faster than on cooler days. But that difference shouldn't make any impact on the effect of the drug. It may just take a little longer to be absorbed on a cooler day versus a warmer day. And then lastly, we've also found that if the animal is in pain, the drug is actually on board longer. It stays in the animal for longer because of the way the pain changes blood flow in the animal and also the physiology of the animal. So provide that pain relief for at least 2 days after administration.
Hans, let's talk about some of the studies that your team has been working on and their practical application here for producers. One of your studies was about lidocaine in relation to castration. Can you give an overview of that for us?
So obviously, if you're giving just a systemic pain relief drug, it's not going to do anything with the pain at the time of the procedure. So it's a little like going to the dentist. If you go to the dentist, you get a local anesthetic block, and that's very effective for a couple of hours. And then after the block wears off, you then get the pain because the block is worn off. And so to really give the optimal pain relief to an animal, you need to use a combination of a local anesthetic with the systemic administration of a drug like Banamine transdermal. And so for local anesthesia, our point of emphasis there is that producers don't want to wait 2 minutes for the drug to take an effect. We've done some work to show that the administration of that local anesthetic actually can be quite effective almost immediately when given at the time of the procedure, so a producer doesn't have to wait too long for it to take an effect. And the other work that we've done is also to buffer the lidocaine. So typically the lidocaine comes in a bottle and folks will administer it straight out of the bottle into the animal. But if you add a compound called sodium bicarbonate to the lidocaine, it actually makes it work much faster and makes it less painful to administer. So it's a very handy practice tip or something for producers to discuss with their veterinarians, ways in which to minimize the pain associated with the lidocaine injection by using a buffer like sodium bicarbonate.
Oral products, they were proven to not be very effective, correct?
So there are oral products available, and one that we've done some work with is meloxicam. The challenge with meloxicam is that it's an extra label drug use. So basically what that means is that there's no label approving the use of the drug in food animals. And so use of the drug in an extra label manner requires veterinary oversight. It requires a veterinary client-patient relationship. And most importantly, it puts the responsibility on the producer and the veterinarian to make sure that if the animals are consigned to slaughter, that they contain no residue of the drug before they're consigned. And so this is an issue for us in the beef industry. We want to make sure that any animals that we put into the food chain are free of any drug residues. And so even though meloxicam, if given orally, is very effective, and we've done some studies to show that meloxicam can actually reduce the incidence of BRD if given at the time of castration in cattle, there are some concerns about the potential for tissue residues. And again, that's something I would really encourage your listeners to discuss with their veterinarians to decide what the most appropriate pain relief drug would be to use on their operations before using a drug in an extra label way.
For producers, what kind of message do you have for them as far as staying aware of what's available in pain management and thinking about how they might apply it in their operation?
It's a great question. I appreciate you asking that because I think we live in an ever-changing landscape when it comes to our interaction with consumers. And our goal is obviously to maintain beef markets and to maintain trust in our product and trust in livestock production management practices. And so it's important that we have a responsibility from a communication standpoint to make sure that consumers are educated in terms of what we do. But also beef producers really care about their animals and they're very committed to the production of beef. And as part of that, we want to make sure that our animals don't suffer. And so pain management is just a component of the responsible raising of livestock eventually for harvest and for the consumer. And so my group is very active in trying to find some production benefits with using these pain relief drugs. And we've certainly observed from a behavior standpoint that animals that receive pain relief do behave in a way that shows that they are not experiencing pain. They're up eating at the feed bunk, all the things that as a livestock producer we like to see after we've done a procedure as those animals are up and at the bunk. But we also want to understand the potential production benefits from doing that. But even if we're unable to demonstrate a production benefit, this is still something that consumers are going to expect us to do from an ethical standpoint. And it's also something that feels like the right thing to do from a production standpoint, because as livestock producers and beef producers, we want to make sure that we're doing right by our animals. It's our responsibility to do that. And pain management is just one component of that responsible raising of livestock as part of our livelihood.
Well, thank you for the update, and we'll look forward to more information as future studies are conducted. Thanks for coming on and joining us, Hans.
Thank you very much, Sarah. Appreciate the opportunity. Thanks.
Once again, that was head of the Department of Anatomy and Physiology with the College of Veterinary Medicine, Hans Coetzee. He was one of the speakers at the 2018 KSU Beef Stalker Field Day. We'll have more here later on Agriculture Today.
Hamburgers, roast, ribs, steak, or whatever you prefer. Beef, it's what's for dinner. Kansas cattle farmers produce 7.5 million head of cattle per year. It takes about 7 tablespoons of peanut butter to get the same amount of protein in 1 serving of lean beef. Support your local Kansas farmers and ranchers. Eat beef. This message was brought to you by the K-State Animal Sciences Leadership Academy participants.
Welcome back to Agriculture Today over the K-State Radio Network. I'm Jeff Wichman. In today's agricultural news, according to the USDA's National Agricultural Statistics Service, topsoil and moisture supplies for the week ending September 23rd rated 2% very short, 12% short, 81% adequate, and 5% surplus. Subsoil and moisture supplies rated 3% very short, 14% short, 81% adequate, and 2% surplus. Wheat planted was 21%, ahead of 13% last year and 16% for the 5-year average. Emerged was 5%, near 3% both last year and average. Corn condition rated 10% very poor, 16% poor, 27% fair, 40% good, and 7% excellent. Corn dented was 98%, near 95% last year and the 96% average. Mature was 80%, ahead of 73% last year and 69% average. Harvested was 30%, near 28% last year and the 27% average. Soybean condition rated 2% very poor, 8% poor, 30% fair, 49% good, and 11% excellent. Soybeans dropping leaves was 49%, behind 57% last year, but ahead of the 43% average. Harvested was 2%, near 5% last year, and equal to average. Sorghum condition rated 2% very poor, 5% poor, 22% fair, 55% good, and 16% excellent. Sorghum coloring was 93%, near 89% last year, and the 90% average. Mature was 32%, near 33% both last year and average. Harvested was 6%, equal to both last year and average. Cotton condition rated 0% very poor, 1% poor, 21% fair, 61% good, and 17% excellent. Cotton bolls opening was 52%, ahead of 39% last year and 34% average. Pasture and range conditions rated 4% very poor, 13% poor, 33% fair, 43% good, and 7% excellent. The National Agricultural Statistics Service also released its latest cold storage report yesterday. According to that report, total red meat supplies in freezers on August 31st were up 4% from the previous month and 4% from a year ago. Total pounds of beef in freezers were up 4% from the previous month and 6% from last year. Frozen pork supplies were up 6% from the previous month and 1% from last year. Stocks of pork bellies were down 14% from last month, but up 82% from last year. Total frozen poultry supplies were up 5% from the previous month and 11% from a year ago. Total stocks of chicken were up 6% from the previous month and 19% from last year. Total pounds of turkey in freezers were up 3% from last month and 1% from the same time a year ago. Total natural cheese stocks in refrigerated warehouses were down 4% from the previous month, but up 2% from a year ago. Butter stocks were down 9% from last month, but up 4% from a year ago. Total frozen fruit stocks up 3% from last month, but down 13% from a year ago. And total frozen vegetable stocks were up 22% from last month, but down 3% from a year ago. In other agricultural news, research is being conducted to overcome current technological and regulatory limitations involving unmanned aerial vehicles in agriculture. Rod Bain reports.
In many ways, unmanned aerial vehicles, drones, have become multi-purpose tools on the farm or ranch. But according to someone who drones on about drones, Oregon State University Extension's Victor Villegas, there are some challenges still in the way of this technology reaching its full potential.
Some technological, but mainly legislatively and rule-wise from FAA and other federal and state regulations.
He says the primary technological limitation is power source. Currently running on electricity, research is being conducted on tech to recharge a drone's motor in flight and expand flight time. As for regulatory limitations,
basically the FAA limits flights to within visual line of sight, so that limits how far you can fly the drone and how much acreage you can observe or scan.
Although Villegas adds the FAA is allowing waivers to some researchers to conduct and study beyond visual line-of-sight flight. I'm Rod Bain reporting for the U.S. Department of Agriculture in Washington, D.C.
Studies show there's a correlation between pregnancy rates on the dairy farm and overall profitability. In this week's Milk Lines, K-State dairy specialist Mike Brook says there are three main factors that have a large impact on the pregnancy rate in the herd.
Today I'd like to visit with our Kansas dairy producers concerning the relationship between pregnancy rate on your dairy and the profitability of your dairy. You know, we look for different things when we're trying to survive in a situation where margins are very minimal, and that's where we're really at in the dairy industry today. So as you look at that, how does pregnancy rate affect the profitability on your dairy? There were some interesting studies completed during 2017 that maybe gave us a better handle on that. And when they looked at pregnancy rate and they looked at profitability per cow on farms across the United States, they found a very strong relationship between those farms that had a higher pregnancy rate and those farms with a higher profitability per cow. So why is that? Well, one of the reasons that occurs is the fact that dairy production, dairy profitability is really related to a continuum of a cow calving, producing a high quantity of milk, becoming pregnant, and then calving again. And to a certain extent, the closer together within reason those lactations are, the more profitable she will be because she remains at a lower days in milk during her lactation and works off the higher end of the milk production curve. So as we think about this and we think about pregnancy rate, what are some things we need to be concerned about? Well, there's really three main factors that seem to have a large impact on pregnancy rate in our dairy herd. One is the voluntary waiting period. How long do we wait before we actually start to inseminate cows? Second one is the submission rate. If she's past the voluntary waiting period, what is the chance that she will actually be submitted for insemination? And then finally, the conception rate. Are we successful when we do inseminate the cow? The reason this is so important is every additional days open above the norm would cost us anywhere from $2 to $5 a day. So if you think about that, and you had to have a 21-day cycle in a dairy cow, those additional days open are going to be costing you per cycle somewhere between $42 and $105. So if we miss 2 cycles, that could be an additional $210 that we lose just because we waited another couple cycles to get her pregnant. Now, there's a lot of things that go into that, things like milk production and feed cost and milk price or culling. All of those are factors that will determine what is our actual cost for an increase in days open. But on all of our dairies, it's very, very expensive. So make sure as you're looking at your dairy herd that you're considering what your pregnancy rate is, making sure that you do those things that are necessary to keep pregnancy rates high and your dairy profitable. This is Mike Brook with K-State Research and Extension.
And that's a look at today's agricultural news. This is the K-State Radio Network.
While many people know hunger is an issue in developing countries, it is also a problem in our own backyards. In 2010, 1 in 7 Kansans struggled to put adequate food on the table. 2 K-State Research and Extension programs are tackling this problem. The Family Nutrition Program and Expanded Food and Nutrition Education Program reach thousands of Kansans in more than 70 counties. They learn how to eat healthy with a low budget. For more information about these programs, visit ksre.ksu.edu.
This Agriculture Today concludes with our weekly segment on wildlife management. Across the way once more is Charlie Lee, wildlife specialist with K-State Research and Extension. Another look, Charlie, from a different angle at the lesser prairie chicken and reproduction research that's been conducted regarding this bird, but it's been at the center of conservation efforts and initiatives in recent times, right?
We've had lots of controversy and concern about the status of lesser prairie chicken populations, so much so that they were listed as threatened, taken off the list, and currently being reviewed again. But the population, at least in the last few years, seems to be on a steady increase. Hopefully that will continue. But the populations of lesser prairie chickens have declined from what they were historically. So we had that temporary listing as threatened. That was just for a couple years. Then they were removed in 2015 from the list as a threatened species. But the continuing threats of grassland conversion to other use or cover types and long-term droughts continues to affect their population. It was a group of researchers at Kansas State University from the Kansas Cooperative Fish and Wildlife Research Unit at the Division of Biology that have had a long-term program looking at lesser prairie chicken. Just recently, they published the results of some of the consequences of Conservation Reserve Program grasslands for lesser prairie chicken and its regards to brooding habitat. Keep in mind that lesser prairie chicken is a species that spends a majority of its time in rangeland habitat, grassland habitat. CRP was planted to primarily native species without a lot of forbs. Most years it's not grazed or mowed, only in emergency situations. So it serves as a unique habitat component out there that's tall, denser vegetation than perhaps some of the areas that are nearby.
So the objective of this study was to gauge in fairly definitive terms just how useful CRP ground is as nesting area for the lesser prairie chicken?
Well, that was the primary purpose, was just to look how well CRP grasslands affect population levels and where those CRP grasslands are located in comparison to adjacent cropland fields or working rangeland areas, to see what type of reproductive success was on those type of locations that had the addition of CRP to those that were in locations without the CRP addition.
So how did this team go about assessing that?
Well, the team captured and fitted 280 female lesser prairie chickens with VHS, or very high frequency, and global positioning system transmitters during the spring lacking seasons of 2013 through 2015, so that they could monitor habitat selection for CRP in various regions of different climates. The area that seemed to be most successful was in the extreme northwest part of their study site, which would have been Logan, Gove, Wallace counties. That particular area typically is dominated by about 7 to 8% CRP lands, about 36% cropland, and the rest, 50-some% of native short and mixed grass prairie systems. Then they followed those hens that were radio marked, documented reproductive success, and where they moved those chicks, if they moved those chicks as they begin brooding and raising those chicks in subsequent years.
So what did they discover about how conducive CRP grasslands are to nesting success?
Well, they found that nest densities were about 3 times greater in CRP grasslands than in native working rangelands, which would mean grazed rangelands. The CRP that supported the high nest densities didn't provide good brood habitat. We found out that 85% of the females with broods that survived to 7 days moved their young chicks to other landscapes. So those surrounding landscapes then were very critical to the survival of that young prairie chicken brood. But it does point out that CRP is very important for nesting, but perhaps it's not the ideal component for brooding or for raising those young chicks. So then that raises a subsequent research question of how do we supply more of that ideal habitat that's necessary for brooding those chicks now that we realize where and how valuable these CRP lands are to prairie chicken nesting.
So it comes down to a mix of land use, really, in a lot of respects, to provide that overall habitat for high-level reproduction.
Yes, it becomes a mix of the heterogeneity from cropland and rangeland and CRP use, and not only the diversity of those types of uses, but also the juxtaposition of those uses. It appeared that CRP was most valuable when it's adjacent to rangeland areas. That's primarily because those young chicks have to physically walk to get to those other areas, and the longer distance they go through that tall, dense CRP, the more energy they're expending, and they seem to do much better when they get into the rangeland situations. So that shows that CRP is certainly important in western Kansas for nesting, but perhaps ideally, if we're concerned only with lesser prairie chickens, that we need to perhaps graze or otherwise reduce the density of that vegetation on CRP lands.
So the hope here is that this study and its findings will lend to the dialogue in the ongoing recovery efforts for the lesser prairie chicken.
I think as we realize for many species, we've got to have a mosaic of different types of cropland, rangeland. We've got to have different types of management on the surrounding land. It needs to be a combination of CRP, cropland, rangeland, in order to have that good nesting and brood habitat in close proximity. That's when it seems to be ideal for lesser prairie chickens.
Once more, this field trial was conducted by the Kansas Cooperative Fish and Wildlife Research Unit out of Kansas State University, and it got into the demographic consequences of CRP grasslands for lesser prairie chicken reproduction. Charlie, interesting findings there. Thanks for sharing those. Charlie Lee, Wildlife Specialist, K-State Research and Extension. That's our time for this Tuesday edition. We appreciate you tuning in. Please rejoin us right here tomorrow, won't you? Meantime, Eric Atkinson for Agriculture Today. This is the K-State Radio Network.